So, if you are familiar with cancer or even lupus, you've probably heard of CAR T cell therapy. And if you haven't heard of it, it is a repurposed treatment that has been used to treat cancer. But now doctors are starting to use it to treat lupus. It uses a modified T cell from either the patient or a donor in order to change the way that the patient's immune system operates. The T cells are removed and modified, then infused back into the patient's blood. Trials for CAR T cell therapy have been held by various patients across the world, but in total, only 40 patients have tried this therapy so far. One of those studies in recent years took place in Germany. Some participants showed remission up to 3 years after having the initial CAR T cell therapy treatment. A separate study was done in the US on 7 different patients who had been taking 5 to 10 different medications to treat their lupus nephritis. Some patients were treated with a higher dose of the medication while some had a lower dose. The patients who were treated with a higher dose reported having more success with the treatment, requiring minimal usage of immunosuppressive therapy. However, one patient did go into a flare 6 months after their infusion. Currently, trials for CAR T cell therapy are only open to individuals who have a refractory illness. This means that their lupus has not responded to standard care, immunosuppressive therapy, or biologics. The reason being is that there is a potential for significant side effects from this treatment, including cytokine release syndrome and immune effector cell associated neurotoxicity syndrome. CAR T cell treatment can cost anywhere from $500,000 to $1 million. Even though the long term effects of the treatment can't necessarily be determined at the moment, most of the individuals who have done this treatment have gone into remission, as far as we know. Could it be a potentially promising treatment for lupus patients in the future? Given the lack of accessibility and testing at the current moment, it doesn't seem like it will be anytime soon, but maybe we could hope.